So it's mainly for Deborah, but first, I remember reading that if you've got an alternative on the left-hand side, there's a 2/3 chance of getting a reward. On the right-hand side, there's a 1/3 chance. Rats will always choose the left-hand side, so they're maximizing expected utility, whereas human beings will probability match, so they'll choose the left-hand side 2/3 of the time and the right-hand side 1/3. So there's a second of rats are more rational than yeah, exactly. So, but my question has to do with this distinction between undetermined and determined victims. And I suppose there are two different ways in which a victim can be undetermined. I mean, it could be that the victim hasn't yet been on, that the victim hasn't yet had his bad number drawn, right? So, you know, we've all got an equal chance of being unlucky. There just haven't been numbers drawn yet. And then once the numbers are drawn, then we see who is unlucky and who isn't. Okay, that's one way of determining whether someone is a victim. And here I can sort of understand why there would be kind of a rational shift in attitude, right? If numbers haven't been drawn which yet determine who is and isn't a victim, then everyone's kind of in the same boat. We've all got the same chance. But then if someone's number's been drawn, then we think, okay, well, actually now I know that someone's unlucky and I have a different attitude towards that person. Whereas I suppose, I'm not sure exactly what the experiment involved, but I think in your case, was it made clear that everyone who's a victim has already had his or her number drawn, and it's just a matter of whether you've been assigned to a victim. So it's not really determined, it's not undetermined who the victims are, but it's undetermined which victim you're paired with, where it does seem much less rational to have that sort of difference in response.
It's not what you said the first time, it's what you said the second time. So let me clarify. There were two things happened. The first thing that happens is there are two random assignments happen. The first random assignment is who are the victims. So 5 people become victims, 5 stay keeps. Those terms weren't used though. The number drawing is about who you have an opportunity to help, which person. And so it's in both conditions you're considering somebody who has 0, so they're all victims. It's just a matter of whether that person's been selected. So whether it's someone among the victims or whether it's number 3.
Yeah, so I suppose it would probably be best to say it's not undetermined who the victim is, but undetermined which victim you'll aid, right?
Yes, the victim under consideration.
Okay, right.
Quickly on that point, but these are all anonymous, right? So
yes.
It's the sheer.
It's all meaningless.
Being determined who, if you help someone, who will be helped. You don't know even when it's been determined.
Correct. It's one of the other 9 people in your room, and that's I think sort of the essence of the experiment is that in both cases, there's this complete lack of information, and yet there's something meaningful about holding this number in your hand.
I have a question for Peter. I don't know how those experiments were designed in which the versus a victim was discussed. But my question is still for Peter, and maybe you can chime in and tell me whether I'm misunderstanding. Why not say that in the case where the victim is described, the person who hears about that can identify in a deferred manner, in other words, by reference to what he or she takes the person talking about the victim to know or not know, so that there would still be something more of a kind of identification, what we have deferred ostension, there could be also deferred identification. So there would still be more of a sense of identification in that case than when you merely talk about a victim. I'm just wondering if that misunderstands what you were doing.
I think in your experiment, the number hasn't been drawn yet.
Correct.
Yeah,
Correct.
so it's not that the experimenter knows who it is either.
Well, okay, but in some of the cases you were talking about, it's the sheer talk about the victim versus a victim.
That was actually just the title of the paper.
Yeah.
We don't actually
Yeah.
manipulate the words. It was more just to represent.
So,
the
okay, you didn't
phenomenon.
have a case where one person talked about the victim as if they knew who it was, but they weren't telling you, whereas another talked about a victim as if it were still general, even for the person who was saying that. See, that would allow for a distinction of identification in a deferred basis. I think you have to make sure that that doesn't happen.
Yeah, that's right. And that's why, as I understand it, the way the experiment was run, they'll say, a name will be selected.
Yes.
Yeah.
So
Well, I'm just worried about the cases where the words "the victim" and "a victim" were used.
we've actually never done that.
Oh, you
It's just the title.
didn't?
That's from the title, but they do say the beneficiary, a family has been,
So we have another study that I didn't present here, a
Yeah.
field experiment where we collected.
Yeah, I must say I got the wrong impression from Peter. Namely, he did talk as if the mere phrases were making a difference. And
well, yeah, in some of your cases, the only difference is they're told,
Well, they're told, and there's in a different experiment we describe families who are on the wait list to get a home built by Habitat for Humanity, and we either tell them that the family's been determined or that the family has yet to be determined.
well, no, but
We don't use
the
the
idea
terms
was
the
the sheer
versus a.
phrases "the victim" versus "a victim."
Yeah.
And what I was saying is, if that's in play, then you have to worry about deferred identification.
yeah, all right, that's right.
So I have 3 quick questions for each of the 3 first speakers. The first question is about this business in the... No, 1 each. So in Deborah Small's Keep case, I wonder to what extent we should speak about identified victims here. And by assigning a number to the chosen loser, and there is now a fact of the matter about who is going to get the money, but subjectively, for the agent, it's just as uncertain as before who this is. So I was wondering, have you done comparative experiments where subjective uncertainty is removed and you actually see the face of the person, and is the identified victim effect even more pronounced in these cases? Or is the mere absence of objective uncertainty all that matters? And that was the first question.
It's a good question. Our point in those experiments is to show that you can get the effect subtracting out the information. But to be sure, when you layer on more emotional information, the effects get stronger. We haven't done that in this study, but others have done things where they manipulate what psychologists and economists sometimes call social distance, or the subjective distance between individuals. So I'm, closest with my children and parents and spouse, and my friends are a little further away from me, and colleagues, and then strangers. And so they can experimentally manipulate these subjective social distances between individuals, and sure enough, the closer you are to someone, the more compassionate you are to them.
If you layer on negative information, does it get?
We actually did. We have one paper in which we did this very weak form of identification, and we identified wrongdoers. And it's a complicated methodology, so I won't go into all the details. But I'm happy to share the paper with anyone. And we find that people are more punitive towards identified wrongdoers. And so we argue that this is not just about compassion; it's really a strength of a more general emotional response.
Okay, well, second question then for Jennifer. So I just want to ask about how far this disgust effect goes. And in your example with the 2 boxes, you specify that there isn't any real difference in the quality of the alternatives. But how far would the disgust effect be operative in cases where there is a fairly obvious difference in the quality of the alternative? So, suppose you first you give me a big pile of money, then you show me a disgusting image, and then you say, do you want to swap for this smaller pile of money? Pretty obviously, you wouldn't swap, and status quo bias wouldn't seem to be a very powerful factor in that kind of case either. So the question is, if the disgust effect is contained or limited to cases where there is, in fact, no big difference between the quality of the alternatives, how worried should we be about the effects of this bias on our decision making?
Yeah, that's a great question. So, can you hear me okay? Yeah. This work is pretty new. I think it came out a few weeks ago in the Journal of Risk and Uncertainty. And so it's kind of a test of the phenomenon phase that we're in with that. And now we have to try to push the boundaries. And as you're saying, explore what the boundary conditions might be. My sense, however, is that it will be pretty strong because status quo bias is one of the strongest human biases. Then we also know in some work Deborah and I have done together that if you change this trading choice paradigm to look at actual spending to get new things and how people price the selling price of something they already have. So again, that's the kind of real money set of studies I was telling you about. People will set a selling price of things they already have that's significantly lower than if they were in a neutral state. And then also, they will pay significantly less to acquire new things. So the sort of evolutionary explanation is you want to get rid of what you have when you're disgusted, and you don't want to take anything in. So I invite anyone who's interested to suggest interesting boundary conditions to test.
Okay, great. And the last question for Amitabh. So you mentioned this anecdote about the airline security people coming to Congress to testify, and they say on their way there, you know, they got into turbulences and they saw that the children strapped in their child seats, infant seats, they were sleeping while the others were crying. And I completely take your point that this is not a good justification for attaching such a high value to preserving a statistical life. But there is another way of reading this case, which is just that, well, this experience identifies a second valuable aspect of these child seats, namely that, you know, when you get into turbulences, the children continue to sleep, they don't start to cry and so on. This is good for the comfort of the other passengers. So there you do have a second factor, which occurs much more commonly, I mean, practically on every flight than actual airline crashes, which should arguably factor in cost-benefit analysis.
Yeah, it should. It's not clear if the NTSB should be in the business of making sure that babies sleep. And even more to that point, it's not clear that Americans are in other areas of their life willing to spend up to $42 million per life year. I mean, so you could basically hire, you know, every nanny in the state of Massachusetts to be on that plane and calm your kid. That's a lot cheaper. So I think that's the point of cost-effectiveness analysis. There's lots of other ways to soothe your child than have the NTSB mandate that we buy a car seat for our child.
No, that's a very fair point. And the point is just that part of the reason why the value attached to statistical lives would have to be so astronomical in this case is that airline crashes are so extremely rare. When we take a much more common occurrence like turbulence, you know, the implicit value we attach to preventing this disturbance of crying children would have...
Which is why I'm sure one reason why wealthier parents are probably more likely on their own, in the absence of the NTSB acting, more likely to buy the car seat and have their infant sleep right next to them, in part because it's good for their quality of life and their sort of, you know, psychic well-being.
Okay, thank you.
Sorry to butt in again. May I direct a comment to Jennifer Lerner? May or may not be helpful. You know, there are vast differences in how introspective or self-aware people are. Now you say, with regard to these emotions, they all make up stories. They're not really aware of what's going on. But I bet you would find that certain rare or talented or whatever individuals would be more aware than others. And I'm just suggesting maybe it would be worth studying that.
Well, that's interesting. It's, I think, quite common in psychology to think that individual differences are profound in this kind of thing. But there is a really strong accumulation of data showing that when it gets down to these simple brain processes, there's much more similarity among people than there is difference. And I can tell you there's another study I didn't have time to present where we did sort of an intervention study and we said to half of the subjects, it turns out that the movie you just saw can sometimes carry over and influence your choice. And if people have seen the National Geographic movie, they tend to kind of go with the box they already have, because this is the neutral default condition. We don't say that last part. And if they've seen the disgusting, where we say the toilet scene, then they tend to want to trade away their box. So we do this manipulation, and it turns out people who are in the neutral condition adjust for it, and even over-adjust for it, and are more likely to give it away. The people who are in the disgust condition say they do the same choice, they don't correct their choice, and they say, I was not affected by it.
I'd be a lot more confident in what you're saying if you had deliberately sought out supposedly intuitive or self-aware individuals, and you'd done this on them. And
Yeah.
that's in a way what I'm suggesting.
How do we find those people? Who are they?
Well, that's the trick. You've got to figure out how to do that. Don't assume you can't, but figure out it's a rather difficult problem. How do you what kind of measures do that? You ask their friends? Do you have some other way of testing it?
Yeah.
But I would think that it is a challenging thing to figure out how to identify those individuals. I'm saying it might be worth trying to meet that challenge.
We have a task called Mind in the Eyes, where we show a lot of faces, and people have to guess what the expression is. And so we could use something like that, perhaps. Thank you.
I'd like to thank everybody for this really interesting presentation, but I have a question which I'll address to anyone. In a certain sense, a lot of the decision science and psychological work is focused on raising questions about what explains or triggers this phenomenon, not what justifies it in any way, if it is justifiable. And so I'm wondering if you have any thoughts about that issue. And Peter's remarks did address that issue in a particular way. So in a certain sense, there was a functional account of we were selected to be social creatures, and we don't want to have these negative intentions formed of a certain sort, and that's a very plausible story. What does it justify in this context?
Well,
So I can put that to any of you.
yeah. Does anyone want to? You're forming an intention toward me, I can see. I guess I would say that what it suggests is that, we've talked about how, from, let's say, a consequentialist perspective, it may be important to encourage empathic responses and so on, and that we would suffer in the long run if we didn't, in our children and in ourselves, allow these empathic responses to develop. In a similar way, you can think that this inhibition is actually a very valuable one to have in relationships, small groups, and so on. And so put that on the ledger as well as a consideration that we might think is important to encourage in people. Now, it doesn't intrinsically justify a preference of this kind. That is, it doesn't say that one is more important than the other. And I wanted to sort of suggest that I don't know that even people believe that. When you give them the straight up comparison, they don't have the same effect. It's a much weaker effect. They still have a little bit of a tendency to give an equal amount to one as opposed to a group of six, because it's still pretty hard to say no to that person in comparison to a larger group. But I think the suggestion is we shouldn't misread this response as detecting some kind of a special strong obligation that we have toward individuals, or that's located in those individuals. Instead, we should understand it as part of the equipment that's necessary to sustain certain kinds of relationships. Is that?
You go first, I'll get back. Let's go, then I'll get back.
Anyone else want to?
I'll say one quick thing about that. There's a tendency, very widespread tendency, to think that when emotion is involved in judgment and decision-making, that emotion degrades judgment and decision-making, both in terms of the process and the outcome. And it turns out, thanks to some nifty neuroscientific evidence, that that's just not the case. And that when there is damage to the amygdala, for example, which is one of the key emotion parts of the brain, that people make suboptimal decisions because the feeling of risk that can be manifest somatically, according to people like Damasio, is not experienced. And then over time, as a result, choices are suboptimal because too much risk is taken. And there's the ventromedial prefrontal cortex is another area that's been identified. If you have damage there, that can be quite problematic. And so this sort of old view, and it is quite old, but persistent, that emotion degrades judgment is just wrong. And so one of the key distinctions that I think is very helpful is between what we call integral emotion, and that's when your feeling relates to the judgment or choice at hand, and contrast that with incidental emotion, which is exemplified by the disgust evidence I gave you. The toilet scene from this movie should have nothing to do with which box you choose, and so the emotion is incidental to it. So I'm oversimplifying here the distinction between these two types of emotion, and you can certainly have two going on at the same time, incidental and integral. But that is one way to get a little bit of leverage on the normative status of emotion.
What's the standard against which, whether it degrades or not, is judged?
Well, it all depends on the judgment or choice at hand. I mean, there are, you can be doing estimates, and the standard then is accuracy. You can be looking at something hedonic, like was described earlier, which poster do I want in my room? And then the standard is something like, do you end up liking it 6 months later? Yeah, so.
Or it could be ability to stay with a plan, for example, or ability even to satisfy one's own preferences.
Yeah. Oh, one other thing that's a related misconception is the idea that if you're feeling an emotion, you are going to process in a heuristic, quick, shallow way. Totally not necessarily true.
Yeah.
There are certain emotions that will make you process more systematically and will reduce bias. And a prime example of that is sadness.
Well, thank you. This is very helpful. What I had in mind in the original question has been partly addressed by what Jennifer and Peter both said. But what I had in mind was there's a tendency that I have to have viewed some of the psychological explanations of this phenomenon as efforts to explain it away in a certain sense and view it as a kind of error theory. This is why we make this mistake. And what I'm not hearing in this more nuanced picture of how we should read these emotions and disaggregate emotional responses in the way Jennifer just suggested is that it's not automatically an error theory, that there may be some value to these, and we should try to figure out what that is.
And they may help us attend better to certain factors, yeah.
So I was very much intrigued that I heard for the first time the findings that Deborah Small mentioned from colleagues in Israel about the difference between the impact of a determinacy about the victim when it was one person versus a group. And I would have expected some of this effect to be present also in groups, because it seems like in many contexts, when there is a group which is even quasi-identified as the potential bearer of some risk which has value for the larger society, we are still reluctant to make them the victims and thereby help boost society. So here's one example. In the 80s, everybody was in love with the idea of airbags. They made it mandatory. 60 million cars later, in 1996, they realized, wait, airbags do save more lives than they take, but at the time they thought, it turned out to be incorrect, but at the time they thought, in a subgroup, old people and short people, they take a few more lives than they save. And that made them really apprehensive about that policy, despite the fact that of mandatory airbags, and they considered making it non-mandatory and all that, because they had to think things like, we are achieving this huge boost for society at the expense of a group. So that seemed to have been present in their deliberations. How do you or do others account for the result of the experiment vis-a-vis this?
That's a great example. A study I didn't talk about today, it's not yet published, but I've seen, actually there's several studies like this now in a paper that's a working paper. What they did in their study is they had groups, but they either gave the group a label or made it into some sort of cohesive unit. So 7 gazelles versus a herd of gazelles, for instance. And when you unitize a larger number, the effect goes away. So in the original studies that I presented here, I might have referred to it as a group of 8, but they were not described as any sort of cohesive. It wasn't like a classroom of kids or a team or something like that. It was merely 8 kids in need. And so I think that part of the nice example that you gave might have to do with the fact that once groups have been made into a cohesive unit, that gives more meaning to them, and it leads us to think about them in ways that are more closer to the way we think about one individual.
So would that mean with the Chilean miners that when there's an outpouring of emotion for them, it's because we think of them as a group that's a sort of a single unit together? Is that?
Perhaps, yeah.
Well, they give them very individual stories and all that, and that's part of the magic.
I see, yeah, that's true too.
Peter, I just had a quick set of reactions to what you were saying towards the end that I'd be interested in your thoughts about. So it seemed to me what the picture you were suggesting put me in mind of was Strawson's freedom and resentment in the following respects. So it's not just victims who feel some desire to hold responsible. It's everyone who feels that. So you have, in Strawson, you have not just personal reactive attitudes, but impersonal reactive attitudes. The object, and what the reactive attitudes are all sort of targeted on, is lack of bad witchcraft, as it were. It's what Strawson calls goodwill, but it turns out what goodwill is a kind of respect. Respecting everyone's, as I would think of it, standing to expect certain things. And then we all expect these things from everyone on everyone's behalf. So the difference between the and so once it's been determined that there's an individual, and could be a group, doesn't matter whether it's one individual or two, though I think it's interesting, this is not in any way against the finding that Deborah has that it makes a difference whether it's one or more. But once there's a fact of the matter, then the thought can occur whether I am respecting that person or not. If it's not yet determined, if we just know there's the risk that someone or other might with some probability, then although maybe there's a sense of failing to respect mankind or something like that. Nobody need feel that they are a potential, well, that an issue of disrespect has been raised with respect to them, nor need the agent feel that he or she has failed to respect any particular individual. So it strikes me that the Strawson's freedom of resentment just is a model of what you were describing.
That's very interesting. I think something like that is probably right. And it's interesting what you were saying just now about groups, because one way to think about a unified group is it's more agent-like. I remember reading an interesting study which found, for those who are fans of British football, this would be relevant. They actually did a study of these hooligans, I guess is their official title, were constantly fighting with each other and beating each other up. But then there were cases where people came to each other's aid, and so they were looking at the actual statistics of this. And it turns out that, of course, Manchester United fans are more likely to come to the aid of a Manchester United fan, but a Manchester United fan is more likely to come to the aid of a Chelsea fan than someone who's got no identification. Because
Boxers embracing at the end.
yeah, well, and because this bloke knows what he's a supporter of it. He's part of that group agent, and yeah. I don't disrespect Chelsea. It's just I don't want him to win.
First of all, I really enjoyed the session, so thank you very much. Great idea to include this. I'm really struck by that one person identification is really important, and then when you increase the victim number, then you kind of reduce your power of emotional reactivity that you presented, Deborah. And then I think that's really a problem if we believe that in health policy and in population level bioethics, we are always talking about population, and that's a great number. And then many of the things are really based on if we have a greater number effect, then we probably should worry about more. So for example, the measurement of health inequalities, if bad health is suffered by more people, the pattern is the same level of bad health, but there are a lot of more people in the population, then the measurement now responds that inequality is worse in the population. So a lot of assumption going in there. But then your talk, Amitabh, you said that one strategy maybe we can deal with is that we kind of use statistics to evoke emotion. And then I don't remember exact number, but that 5 children will be dead against if you implement this policy and drive the car. How many kids? It's like 82. Maybe we're lucky that there was only 82.
Yeah, but this was 82 children. Yeah, that's right. 82 children. 5 kids versus 82.
Yes,
yeah.
But I wonder that there's a little paradox in our mind that if it is a lot of kids, then it becomes that somehow that smaller kids dying evoke more emotion for us. That it appears to be, and then we start to put more identification in there. That seems to be like for us. When we are thinking rationally about it, of course, greater number of kids dying is more serious, but maybe that's lost at some point if we have more number. So it's just maybe it's a comment, but my question is that knowing that now we know clearly in experimental setting that some one identified victim is really people respond to it. That's probably natural inner wiring of brain. Then how really can we use that to our advantage to promote the policy we want?
Yeah, I think what makes that example of the study that the FAA did that was so wonderful was that they said, if you mandate that parents have to purchase a second seat for their child, this will save the lives of 5 babies. But that exact same policy will cause an additional 82 infants to die as a result of driving more. So now the brain can't sort of come up with it's the exact same policy. You're doing one thing, but then on the other hand, you're doing this other thing. It's not that they said, here's another policy, because then I think people may have kind of fallen back into this trap of saying, well, these are two different things. But here it's the exact same policy. Now, maybe, I mean, Ralph Nader didn't believe that. I read you the quote, right? Even after the study came out, he said, I don't care. Yeah, I mean, he said, these are statistical babies. Theoretical babies is what he said. Never mind that those 5 babies were also theoretical babies.
He also said vote for Ralph Nader.
He also said vote for Ralph Nader, yes. Yeah, so I think the way forward on this is sort of, there might be 2 ways forward. One is to do what my colleague Atul Gawande is able to do incredibly well, which is to read the clinical literature, to read the economics literature, to learn the truth from that academic, very deliberative literature, but then to write a narrative. Yeah. And the narrative happens to just fit the data perfectly. That is an immensely powerful tool, and it has changed the minds of many intransigent congressmen. Reading his narratives can change their minds. So that's what I had that's what I had in mind. The other view is to sort of create a more deliberative organization that decides how we spend healthcare dollars, because there will always be, and I'm thinking about cost growth in healthcare, it's very easy to show up with stories, correct, true stories of patients who've been saved by medical technologies. And it's very hard to tell the story about all the other Americans who went without health insurance because we gave some people so much. The president was very good at doing this, but then he failed. At the time that he was advocating for the insurance expansion, rather than trotting out number after number on what the benefits of insuring the uninsured would be, he kept telling the story of that 10-year-old child who lost his mother because his mother didn't have access to health insurance. That is powerful. But that's advocacy also. That's no longer science. So I get really nervous when it's just one story versus another, because then the person with the better story wins. If it's Atul's story versus everybody else's story, I go with Atul. But that's pretty much the only person I trust.
Great, thank you.
I want to ask a similar question, maybe a little bit differently. So the thing I thought was a wonderful panel. The thing I was struck on actually was the fragility of the effect that we've been talking about. And in particular, the possibility, I mean, I thought the UNICEF or whatever it was slide at the beginning was kind of interesting. It made me a little ambivalent in that, oh, it's such a great cause and the like, but I'm being manipulated here, right? They figured out the algorithm. So I kind of wanted to just invite you to maybe talk about how you see the work you're doing fitting into the libertarian paternalist kind of project, the nudge project, whether you think there's an ethical question here or something that makes you uncomfortable about using some of these tools to bias or debias in ways that are either libertarian paternalist or libertarian welfarist. And, and I'd be happy for anybody to respond to that.
Sure. So I guess I don't think of my work exactly as fitting into the framework of nudge, because I'm not talking about any sort of regulation or limitations of freedom, but it's persuasion for sure. And just as consumer packaged goods people practice persuasion, charities practice persuasion, and as Atul Gawande practices persuasion, and we all, academics practice persuasion when we're selling our work. And so certainly at times that leaves me a little uncomfortable, but I think that, I see my job is to try to understand human behavior, and that knowledge is there, and I'm pleased when it can be used for good, and I try not to take too much responsibility if it's used for not so good. So there you go.
I was wondering if the concepts we've discussed this afternoon can be formulated in evolutionary terms. After all, for evolving hominid communities, the statistical populations would have been overwhelmingly hostile. And so I'm wondering if, for example, in communities of primates in the wild, whether some of the concepts that were discussed this afternoon are echoed in those communities.
Well, I'll say something about that. Yes, absolutely. And, you know, I think of emotion as evolving and to serve primarily adaptive functions, and that it is valuable when we're mad. You know, picture a Pleistocene era family, and where Homo sapiens were evolving. You know, if somebody comes and threatens me or mine, the key is to react quickly, and that what enables me to act quickly is that the anger mobilizes all these coordinated response tendencies. And so absolutely, I see that there is, you know, the possibility of an evolutionarily adaptive kind of situation. My view about this problem of emotional carryover of incidental emotion, is that we, and this is pure speculation here, is that in Pleistocene environments, you didn't quickly change from one thing to the next. And you didn't quickly change the group that you're interacting with. And so the tendency for emotion to linger and to continue to shape your thought was less of a problem. Whereas now, we've documented these sadness effects where you pay more to buy things when you're sad than if you were in a neutral state. Doesn't matter what you're buying. And so I picture sad people up late at night on the internet buying stuff. And, you know, because the sadness does persist. Yeah, and yeah, believe me, that
They're thinking about it.
yeah, like Deborah said, we have to, you know, really swallow a pill there about ways that people may use this research. And so I think it's an example where the social ecology has changed tremendously, but the brain development is really more designed for a different cultural structure. That's speculation.
While we're speculating, there's this thing that we see in medicine a lot, where if you approach a group of doctors and say, in an experimental setting, we have a new medical technology and it works 40% of the time. Some fraction of them will say we'll adopt it for our patients. And then you say to this other group of doctors, well, the technology works 42% of the time. So you've gone from 40 to 42%. You'll see a little bit more take-up because more people think that it's valuable, which is absolutely correct. So now if I do the same experiment, rather than increasing the probability of the technology being effective from 40 to 42, if I change that from 49% to 51%, you see cascade effects in take-up. So right around the 0.5 threshold of something working, you see almost everybody adopt the technology. It's almost like what physicians are doing this is only in a time-sensitive environment, and that's usually what when they're working, is that they tend to round probabilities below 0.5 down, or they're deliberative about kind of deciding whether it works or not. But above 0.5, they tend to assume it always works. And to connect this to what Jen just said, I always thought, without having studied it, that this was actually, it wasn't rational, but it was the consequence of the fact that for millions of years, we never had to figure out how behavior should respond to a change in probabilities from 0.4 to 0.42 versus 0.49 to 0.51. We were sort of thinking about, here's a probability of getting killed by a herd of rhino, and here's a really big probability of getting, there's a bigger herd, so it's a bigger probability. And that this is sort of a consequence of, you know, mathematical and statistical discoveries that will probably take us millions of years to really finally, you know, evolve to understanding correctly.
I guess I have a little, go ahead. I have a little bit more optimistic view that, in fact, we were evolved to respond even to small changes in probability. The question is, how do we represent them to ourselves? And if you can find naturalistic ways of representing them to people, as people have found with medical statistics, if you can find naturalistic ways of representing them, people will be influenced by them in a much more systematic way.
You're thinking about frequentist approaches
Yeah,
that
like
Gigerenzer has done?
representing things in terms of frequencies, which is a naturalistic way of understanding the environment, as opposed to probabilities, which are ratios. That's also true.
Yeah.
Yeah.
All right, I think we've reached the end of our time for this session. I want to just thank the panel one more time, please.